My name is Claire Hughes, and I am going to be presenting on systemic lupus erythematosus. It is systemic. It can affect all organs and parts of your body. Erythematosus is the term for red markings or rash on the skin. It's a fairly broad, reasonably broad term. Lupus came from a medieval physician who saw lesions on one of his patients and compared them to a wolf bite, and similar lesions can occur with lupus today. It was supposedly first described by Hippocrates. He put it under the same umbrella as herpes with the rashes and lesions and such. It was first described in 1838 by Laurent Theodore Biet, and it was named lupus erythematosus in 1850. And these are your associated individuals. It is a connective tissue autoimmune disorder. Its 10-year survival rate is approximately 90%. If you're going to have life-threatening complications, it's more likely that they're going to occur within the first 5 years of diagnoses. Infection is a prevalent cause of death with this autoimmune disorder. It is more prevalent in women than men and children, and it tends to be more severe in men and children. It is more you're at an increased risk if you're in a non-white population, and your general age of onset is going to be between 15 and 44 years old. First manifestations or symptoms are probably going to appear about a year and a half before someone will get a diagnosis. Environmental triggers will include UV light, drugs, and supplements. Infections, Epstein-Barr virus has been noted specifically. Smoking, silica, mercury, psychological stress. Your big one is going to be UV light. There are genetic associations, and I've listed a couple on the slide. There are the antigens associated with lupus will appear years before any symptoms occur. You're commonly going to see anti-double-stranded DNA antibodies, anti-Rho antibodies, anti-phospholipid antibodies, anti-nuclear ribonucleoprotein antibodies. It's a mouthful. And you'll generally have one of those at least before, and then new antibodies will appear just before diagnosis, so you generally will have at least 3. This was discovered by taking serums of military personnel from before their diagnoses and testing for these particular antibodies and seeing when they first appeared. Pathogenesis, it's a feedback loop in both the innate and adaptive response. It's thought to begin with apoptosis of individual cells or dendritic cells and neutrophil extracellular traps don't do their job quite correctly, and there's uncleared waste that can cause an immune response, and when that immune response is being caused by your own cells, you lose self-tolerance, and that's how you start generating those antibodies. Manifestations, so your symptoms are generally going to be caused by inflammation in different organ systems, vasculopathy, which is damage to your blood vessels, and then there are some direct effects of the antibodies as well. So arthritis is going to be your biggest symptom. It's generally in the hands and fingers and the knees. Tendinitis is also fairly common. They are two different things. Arthritis is inflammation of the joints. Tendinitis is inflammation of the tendons. Arthritis is again the most common at about 90% of individuals having that. Erythematosus, the butterfly erythema is, or the butterfly rash, the male erythema is the most common, most associated symptom with lupus. You also have your patchy maculopapular rash and your subacute cutaneous lupus erythematosus. So those two look fairly similar in pictures, but they are different things. The maculopapular rash is raised papules that are uniform in shape and color. They're circular, and then you can also get bulbous lesions. This photo isn't very good, but there is buildup underneath the skin, and lesions can occur here. In the throat and the mouth, you can get non-infection pharyngitis and oral ulcers that can be seen here with discoloration. In your kidneys, you can get nephritis, which is inflammation of the nephrons, and that damage can be very severe. Kidney failure is a big killer in this case. Your central nervous system, cognitive dysfunction does occur. It's usually mild. Microfocal scarring associated with changes in small arterioles. So again, that's that vasculitis, vasculopathy, damage to the blood vessels. Strokes and intracranial hemorrhages are frequent. Seizures occur and migraines are common. In your heart, you will also see inflammation, pericardial effusion, which is liquid in the pericardial lining. Cardial lining can be the first manifestation. You can get valvular abnormalities. Cardiomyopathy, which is damage to the muscles in the heart, is often detected with lupus. It's not always a problem. It can be. In your lungs, you will also have inflammation. You can have pleural effusions where there's buildup of fluid. You can get collapsed lungs, and then interstitial pneumonis and pulmonary vascular hypertension can also be present. So inflammation in your blood vessels can lead to damage in your blood vessels. And then also you see thrombocytopenia, which is a lower platelet count in your blood, which can cause all sorts of problems. You can also see damage in these organs. Your liver function can be decreased, gastrointestinal function can be impaired, and also you can see alopecia. Generally, it's not permanent, but you can get scarring with that. So for diagnosis, again, your polyarthritis or arthritis in multiple joints and dermatitis, which is the rashes and such, are the most common symptoms. So your early symptoms are your arthritis, your thrombocytopenia, pericarditis, which is inflammation of the lining of the heart, chronic fatigue, which can be accompanied with fibromyalgia, which is unexplained pain, and disturbances in cognition, often anxiety and depression, and then general cognitive impairment. So anti-nuclear antibodies are present in many autoimmune disorders. Lupus is no exception, but it's not specific to lupus. If you want to be more specific, you want to look at anti-double-stranded DNA antibodies, which is associated with nephritis, vasculitis, anti-SM antibodies, which are associated with nephritis and central nervous system issues. Anti-RNP antibodies is associated with arthritis and Raynaud's phenomenon, which is the when you lose color and blood flow in your fingertips, and it is very painful. And then anti-Bro antibodies are associated with dermatitis, and antiphospholipid antibodies are associated with embolisms and other vascular issues. You can test for anti-nuclear antibodies with fluorescent tags, and based on the visual appearance of the assay, you can tell if it's just anti-nuclear antibodies or if you have these other antibodies as well. So for diagnoses, you need 3 out of 4. You need the anti-nuclear antibody test to be positive, but you need the characteristic rash, you need the reduced number of platelets in the serum, and then you need serositis or nephritis. Nephritis, again, is the inflammation in your kidneys, and serositis is inflammation of the linings around your organs. Generally, people come in with arthritis, central nervous system, cognitive dysfunction, or other things, history of rash or Raynaud's phenomenon, and a weak positive antibody test. If you have this, it's fairly certain that they have lupus, but you do want to check for stuff that's not visible to the eye. So drug-induced lupus erythematosus is a disorder that resembles lupus, and it can be caused by a number of drugs, and it's generally milder than lupus and will subside after treatment is ended. So when you're trying to treat lupus, one of your focuses is immunosuppression. So your corticosteroids, cytotoxic immunosuppressants, calcineurin inhibitors can all treat flare-ups. It's not a long-term solution. It can cause organ damage, and generally you want to avoid that unless it's absolutely necessary. Hydroxychloroquine is the main treatment for lupus. It's an immunomodulator. It's been demonstrated to prevent organ damage and prevent seizures and CNS complications, as well as general inflammation and such. Vitamin D is also a supplement that people with lupus should take. It's also an immunomodulator, and it is specifically antifibrotic. We want to focus on reducing comorbidities, cardiovascular events, infection, osteoporosis, and treating the symptoms of different organs as they have their issues. Lifestyle changes. You generally want to avoid the sun, as the dermatitis is photosensitive, and increase exercise to improve mobility and reduce pain. And then arthritis and inflammation can be treated with NSAIDs. And those are my references.